This presentation I am going to talk about PD1 and PD-L1 inhibitors. So let's begin. PD1 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 PD stands for program cell death. So it is a protein. An important function of immune system is its ability to tell between normal cells of the body and those it sees as foreign. So this lets the immune system to attack the foreign cell. So first our immune system differentiates what cells are normal and what cells are foreign. Then it attacks and kills the foreign cells. For that purpose, it uses several checkpoints. One of them is mediated by PD1 and PD-L1. So this is the PD1. PD1, this protein is found on our cells, immune cells, T cell, B cells, and other cells, mainly T cells. Moving on. PD-L1. PD-L1. PD stands for programmed death and ligand 1. So this is a receptor. PD1 is a protein and PD-L1 is a receptor for that protein. So this receptor, this ligand is found on our normal cells and some of foreign cells such as cancer cells. Not foreign but cancer cells, not normal. So found on normal cells and cancer cells. The amount of this ligand is higher in cancer cells and lower in normal cells. So this protein and this checkpoint acts as a brake to control the immune response. So this is PD-L1. Now let's talk about PD1 and PD-L1 checkpoint. So here we can see that this our immune cell is having PD1 protein and this is the tumor cell. So this is having PD-L1. Suppose if it was a normal cell, it were having PD-L1, and by which the PD1 recognizes this cell as our normal cell and leaves without attacking this. But in this case, this tumor cell is also containing this PD-L1. So our immune system will leave this cell unattacked, thinking it's our normal cells as it contains PD-L1. So, uh, so our immune system, cancer cells outsmarts, or we can say skips our immune system by expressing PD-L1. Yeah, PD1 is same PD-L1 and thus escapes this checkpoint. So to attack those cancer cells, we need to inhibit this checkpoint. So for that, what we can do is, we can have inhibition of PD1 and inhibition of PD-L1. That's what we have done. So we have inhibited this PD1 by anti-PD1 and PD-L1 by anti-PD-L1. So we give these molecules to inhibit this interaction, by which this PD1 can't bind with PD-L1 and hence our immune system will attack this tumor cell. So let's see what are PD1 inhibitors and PD-L1 inhibitors. So these are PD1 inhibitors: pembrolizumab, nivolumab, semiplimab. So these all are monoclonal antibodies. As we can tell, they contains MAB or LIMAB. Next we have got PD-L1 inhibitors. So these are atezolizumab and avelumab and durvalumab. So these are our PD1 and PD-L1 inhibitors. Next, these drugs have few side effects. So the common side effects are diarrhea, pneumonitis, and rashes and itchiness. They can cause some problems to our hormone levels, and there's also kidney infection associated with use of these drugs. Then we have got we will see about the clinical efficacy of these drugs. These drugs are, although these are approved by FDA for the use, but we these drugs are still under studying for its efficacy. So we can see these drugs are used in various types of cancers. And here we can see the results. For lymphoma, out of 757 patients, 456 responded to it. So 62.13% is efficacy here. Then we have got our Merkel cell cancer. We can also see a good response there. Cutaneous cancer, melanoma, renal cancer, and so on. We also have used this in lung cancer, and then uterine cancer, head and neck cancer. Here we can see thymic cancer, breast cancer, glioblastoma, so biliary tract cancer, ovarian cancer, and prostate cancer, colorectal cancer, germ cell cancer, and all this. So we can see here germ cell cancer, it's not effective in germ cell cancer because no out of 31%, none of them is responded. So this is about the efficacy of these drugs in clinical trials.